He is aged 8 years. খুলে দেখো টমেটো খুলে কেস অফ এগুলো কি হয়ে গেছে দেখি হাত গিয়ে দেখিয়ে শুধু সবাইকে যাও একটু একটু করে এগিয়ে যাও দেখবে হাতটা টিপে দেখবে কেস অফ exostosis all over দাঁড়াও একজনের কাছে দাঁড়াও have a feel of the left hand and yet you can bony exostosis bony outgrowths all over his body not only in the hand আর কোথায় কোথায় আছে প্যান্টটা খোলো ছোট প্যান্ট আছে ভেতরে all over his body since around 20 to 25, that's how many they can count, and gradually increasing. Started at 2 years of age. প্রথম শুরু হয়েছিল কোথা থেকে first started in the left wrist there is a nodule here these are exactly what you call stony heart দেখে দেখিয়ে এসো একটু যাও কিছু লজ্জা নেই সবাই ডাক্তার পেছনে যাও That left wrist swelling started after a fall. After a fall. That is the biggest one. ওটাই সবচেয়ে বড় তো? Yeah, the around the left wrist.
Did he break something or did
They're not sure, but it's a question mark if there was a fracture of the radius. There's a question mark, but not sure. Hard, stony hard, right? That's what the bony tumor is like. কি পরিবর্তন হয়েছে আগে থেকে? There's one in the left, কোন দিকে? বাঁ দিকে? Left rib, father says that's a little better. বাকিগুলো? Previously it was increasing very quickly. There has not been any further increase. It's static. Only the one in the lower rib that is better. Everyone saw it? Yeah. One in the lower rib is better. When you have these kind of outgrowths, I'll come to the remedy in a moment. There's no particular constitutional picture as such. These kind of outgrowths, your well-selected medicines haven't worked. Have a look in Borica, please, in the relationship of calcarea fluid, conchiolinum. Conchiolinum. For these kind of bony outgrowths, conchiolinum. Conchiolinum in the relationship of calcarea fluid. Relationship of calcarea fluid, isn't it? No, where is it then? No, just give me a moment. No, not in calcarea fluid, sorry. Relationship of Hekla lava. Relationship of Hekla lava. Conchiolinum, mother of pearl. But the important factor for conchiolinum, my friends, is it is sensitive to touch. So when you have bony outgrowths which are sensitive to touch, anyone got that? Hekla lava relationship. Conchiolinum, mother of pearl. Parts extremely sensitive to touch. Got it? 200C, 1M for concholinum. 200, 1M for concholinum. So there was no sensitiveness with his case. Remember, when it's a bony outgrowth post an injury, that is wonderfully addressed by Hekla lava. We started this case with Hekla lava, 30 followed by 200. Bony tumors post an injury, doesn't mention Boricae about injury, but many Medicas mention about the injury aspect. So put a note there, exostosis which has started, never been well since injury. Hekla lava. We started this case with Hekla lava. (30) followed by 200, considering the etiological factor. If you see in Hekla lava, where you are looking for concholinum, of great use in exostosis, nodosities, but put a note there, after injury. And many times, this is a clinical tip I have learned, that many times you can have a bony tumor which is of a spongy consistency. So it's not very hard bony tumor, but a spongy texture. We had a patient who was playing soccer and got a kick below his knees, and there was a small patellar outgrowth which was soft. It was a bony outgrowth, but it was of a spongy consistency. You can feel it. It was not hard like a bony tumor should be. So put a note in Hekla lava as well, bony tumor of spongy texture post an injury. I repeat, bony tumor of spongy texture post an injury. Hekla lava can address that as well. You're with me? So you can get these type of stony hard growths as well in Hekla lava post an injury, but you can also get bony tumors which are spongy in consistency or texture post an injury as well. And in both the cases, Hekla lava can be of great value. Exostosis here. We started here 30 followed by 200 with Hekla lava. This was sorry. 30 followed by 200 in February last year. Boosted in between. August we repeated a 200. October we went to a 1M, and last prescription was 15th of October, Hekla lava 1M. আগের বারে যা ছিল তার থেকে এই 2 মাসে আর একটু ভালো বলবেন না সেরকমই? কি দিক দিয়ে একই রকম? মানে আর বাড়েনি, আর এইটা দেখতে একটু কমেছে। এটা আগের বারের থেকে কমেছে। This is there was one here which he says is better. দেখি এসো কাছে এসো। এটা আগের বারে যা ছিল তার থেকে কমেছে না সেরকম? ঠিক বলছো? He says this one has reduced since last visit. The other ones are the same. No new ones have come up since starting of treatment. প্রথম জবেতে খাচ্ছ নতুন হয়নি তো? No new ones since the starting of treatment.
Parents have also very grow sometimes.
কারুর আছে এগুলো? ফ্যামিলিতে কারুর আছে?
No.
See, the trigger, other ones didn't start after the injury, but the triggering factor was the injury. That's why I started with Hekla lava, right? Because there was an injury factor to start with it. We're boosting today. He says the right rib one is a little bit better as compared to last visit. Creamy?
No, sir.
There was worms in between with bloating. I gave him Embellia ribes. I've talked that medicine with you. Fantastic medicine for acute worms. Worms with little bit of abdominal pain he had. Embellia ribes. There's an Indian herb tincture of 6C. I gave him in tincture, and that completely took care of it. You see, again, one of the major utilities of organopathic is to take the patient as much away from conventional treatment. I give them deworming medicines every 2 months. I don't need to give it. You have Embellia. If you see symptoms, give it. Yes.
So you make the vitamin strong enough to throw off the worm infestation, for example, with the remedies, so that you can organopathic? I don't know, yesterday we had a
To answer that, one of the factors about organopathics is it is substitute, it is replacing the conventional medicine. So the suppressive effect the dosage of a conventional medicine will have on his system is far less as compared to the organopathic. B, with the organopathic, whenever you are prescribing it, you are still following the three basic principles of homeopathy, similia, simplex, minimum. So there is hardly any question of suppression even with the organopathic here. If he was not on any conventional medicine for the worms, father used to give him deworming medicines every 2 months. So in that way, I asked him not to take that, take the Embellia instead. And again, Embellia can be withdrawn completely as well, because you are still following the three basic principles here. Okay. If he was not on any conventional medicine, I would have just let it alone. Hekla lava is doing its bit, so that he doesn't resort to conventional medicine. That's the major aim of the organopathic. So that we don't need to resort to conventional medicine for this case.
Sir, and in Hekla lava, it is given many cases worms from 2-3 inches long were found in bronze.
That's good. It's interesting. Thank you for sharing that. We are boosting today with Hekla lava.
And also, sir, I think because they are organopathic and plant-based, the action is not on the dynamic level. Like how
Yes, that we have shared with you. Organopathics, whenever you are prescribing, its action is more on the particular organ level, which doesn't interfere with the action of the constitutional remedy. But the only factor why I gave Embellia for his case, so that he was not taking the conventional medicines at all, right? So that we could withdraw the conventional medicine. Even prior to coming to us, there was worm infestation, but obviously, he's not traveling to see me for the worms. The major concern was this. So we have started with Hekla lava in the case. But as you don't need them to resort to conventional medicines often and often, which even can suppress the case. That is where suppression can happen. Instead of that, give them Hekla lava, give them the Embellia, which will act as an organopathic, so that the dependence on conventional medicine is reduced. ঠিক আছে, করে দিচ্ছি। Thank you. নিচে দেখান না দিয়ে দেবেন করে দিন।
Thank
Thank you.
ভালো থাকবে, ঠিক আছে?